Thank you very much, Mr Deputy Speaker, and I really do feel privileged to speak in this debate. It's been an absolutely terrific debate and some fantastic contributions, and that isn't to denigrate the contributions of the honourable members who take a different point of view, but I particularly want to associate myself with the remarks of my good and honourable friend, the member for Manchester Withington, and the Right Honourable Member for Reigate, and the Honourable Member for Edinburgh East, and the Honourable Member for Inverclyde and for East Lothian, because I think this is an important subject, and I'd like to thank the Backbench Business Committee for granting the time. Clearly, we've had 50 years of failure with the Misuse of Drugs Act. You know, any analysis, objective analysis, it indicates that current policies are not working. And for me, that means it's time to try something new. There's been some terrific suggestions about pilot schemes, something that I've advocated for a number of years now. I might say originally I had the same views as the members opposite, but I've taken the time to get involved with the subject, to meet people like late Ron Hogg, who was extremely brave, our former police and crime commissioner in Durham, who introduced some heroin-assisted treatment programmes, diversionary programmes. Mike Barton, our chief constable, extremely brave. It isn't a popular measure with the general public, but it was effective. It was effective in reducing crime, in reducing the number of avoidable drugs death, and successful in removing some of the burden from the criminal justice system. Problematic drug or alcohol deaths are higher in areas of significant deprivation. I think that's a given. It's another reason why I'm very concerned about it. I don't consider it an individual moral failing. I don't make such judgments, but there's a complex interplay of economic and societal and family factors which affect someone's chances of developing substance misuse issues. But I think we need to ask ourselves what the Misuse of Drugs Act has achieved. In the late 60s, as we've heard, about 1% of adults had used drugs at some point, which are now criminalised. It's now 34%. Heroin use has risen exponentially, 25-fold since 1971. Cannabis use has risen 5-fold. Tens of thousands have been imprisoned and hundreds of thousands of years have been served. More enforcement won't solve the problem. Mr Deputy Speaker, I'm a member of the Drugs, Alcohol and Justice Cross-Party Parliamentary Group, and that stands for evidence, not prejudice in policy, and treatment, not punishment in practice. The group's advised by Humankind, With You and the Westminster Drug Project, charities which together support around 150,000 people across the UK each year. And although the third sector is well placed to support those with complex needs and with vulnerabilities, and also has the necessary talent and tenacity and experience to do this, it has lacked resources due to a number of years of cuts to local budgets. Significant and sustained investment is needed now to rebuild and reinvigorate our services. If we don't, we're simply storing up problems for the future in the way the services are delivered at present. In order to address health inequalities effectively and create change for people who are most affected by these inequalities, the government must commit to a public health approach rather than a criminal justice approach to drugs policy. I would like to also recommend Neil Wood's book, Good Cop, Bad Cop. It's a very instructive read, an undercover policeman in his experience. It is an inconvenient truth, and indeed Paul Townsley, the Chief Executive of Humankind, said, after 50 years, it's high time government really committed to taking a health-first approach to drugs use. Locking people up hasn't worked, but we know that access to high-quality treatment and support does work. Over 25 countries across the world have decriminalised possession of some or all drugs, and the international evidence shows an alternative policy is possible and effective. Thank you.
Very much.